Canada's Truth and Reconciliation Commission documented the horrors of Canada's residential school system, with systematic policies that would remove the legal, social, cultural, religious, and racial rights for Indigenous peoples within Canada, in what was nothing short of cultural genocide. 94 calls to action were issued to guide and inspire a process of truth and healing, including for healthcare. But to truly achieve reconciliation, we must first understand how the history of residential schools and racism impacts both experiences and outcomes in health and care.
You start with the residential schools and the Indian hospitals, and you have these two institutions running parallel, both of which basically take children and families out of our communities and isolate them and treat them really badly. In my family, we had 3 full generations on Paul's side of the family attend Cooper Island Residential School. My children's generation are the first full generation out of residential school. So when you think about these parallels of these huge institutions that basically took our children and families away, and then you look at healthcare today, there's a lot of people that aren't trusting of the health system, and they remember and we remember the stories. So even though I didn't go to an Indian hospital, I've learned the stories. My children have learned the stories. Our communities have learned the stories. Nanaimo Indian Hospital, I don't know a family that I come into contact with that's from Vancouver Island that didn't have a family member that ended up in that institution for one reason or another. And I don't hear many good stories coming out of that hospital. It was much more about control than it was about health care.
I feel heartsick, and I feel like there must be some way that we can change everybody who provides services to Indigenous people.
Because many of our structures, like healthcare, come from kind of societal norms, how we've unintendedly built processes that build in racism.
Yeah.
And it's not a fault of the people in the system, but it's time to change.
Yeah.
It's time for us to revisit those processes and some of those biases that we don't even know exist. And I don't think we can do that alone.
In order for us to move forward, we have to really, really be courageous and say that we will strive to be an anti-racist island health organization, and we will take racism seriously. And when we hear issues of racism, we will deal with them.
I think we're on the right path. I think we just need to do more of it, and we need to reach deeper into our organization so that everybody who has anything to do with Aboriginal health care knows why they're doing it and knows that they should treat Aboriginal people with respect.
I've asked the question actually of Joe Gallagher, what does cultural safety mean? And he said, culturally safe care is defined by the person receiving the care. And humility really is about me. It's about where my own biases are and where my beliefs may be, and actually not thinking I'm right, but that there's more for me to learn and more for me to experience through the eyes of someone else. We have great partners in First Nations Health Authority, and we also need to mature our relationships and partnerships at the local level with the chiefs and the local communities, because no one community has the same needs, and they've also had their own stories. And so we need to understand what their experience has been with the health system, what their experience may have been with Island Health, and what they need to see change in terms of that relationship.
Yeah.
Our journey at Island Health to achieve excellent care for everyone, everywhere, every time, takes a community of caring, responsive individuals. As we approach National Indigenous Peoples Day, we want to recognize Dr. Evelyn Voyageur, who not only represents but encompasses cultural humility. Dr. Voyageur has been nationally recognized as the recipient of the Inspire Award for Health, representing the highest honor the Indigenous community bestows upon its own people. Her work is changing Indigenous healthcare through integrating spiritual, emotional, physical, and mental health. Thank you and congratulations, Dr. Voyageur.
The opportunity also with National Indigenous Day is to invite the over 20,000 of us at Island Health to stop today and reflect on what we need to learn and take advantage of some of the opportunities that we have here at Island Health with the online training, with our cultural safety facilitators, and also getting to know the people in our communities who are Indigenous and have stories to tell us and experiences to share.